You know what else isn't a popular idea? Bird flu. Bird flu. Today in Long Island, New York, a duck farm that has been in operation since 1908 shut down. They had to shut down to start the process of euthanizing their entire flock of 100,000 ducks. Because at that farm in Long Island, New York, they've got a confirmed outbreak of bird flu. And bird flu has now killed more than 130 million birds in the United States, in all 50 states. In 28 states, they're now testing their dairy cows for it as well, because it has jumped from birds to cows, which means one of the risk factors they're now alerting people to for this thing is consumption of or contact with raw milk. It's a risk factor now for bird flu. Nearly 70 people in the United States have been infected with bird flu thus far. We've even had deaths of people's pet cats because the cats have drunk raw milk meant for human consumption. The raw milk was from cows infected with bird flu. It gave the cats bird flu, and then the cats died. Because of all that very bad and now very fast-moving news about this new epidemic, the CDC just sent urgent guidance to American hospitals, advising hospitals that when people appear at the hospital with flu this flu season, people shouldn't just be tested for normal flu. They need to be tested for bird flu as well, because that needs to be handled differently. And anybody who tests positive for bird flu needs to be separated from other patients. Hospital staff need to know about it in order to wear appropriate protective clothing to protect themselves. I say the CDC just sent that urgent advice to American hospitals, but when I say they just sent it, what I mean specifically is they sent that advice last week while President Biden was still president. Because now that President Trump is president, he has ordered that the CDC and all U.S. health agencies should no longer release any information to anyone on anything. Not just to the public, but to scientists and doctors and hospitals. And that includes the CDC's flagship health alert publication for doctors and scientists called MMWR, Morbidity and Mortality Weekly Report. This week, CDC was scheduled to publish several MMWR reports, including 3 about this burgeoning bird flu outbreak that is happening and rapidly progressing right now. Those alerts, those MMWRs, are not going out. They were as of last week, and what was going out as of last week was alarming. As of this week, with Trump in charge, no. He has ordered that all information be stopped, including scientific information to advise hospitals on how to deal with this emerging epidemic. Is that popular? Is that a good idea? Is that perceived as a popular idea among the American people? Is that what you thought you were voting for? You may have noticed recently at the grocery store, you might have even noticed new headlines recently about the price of eggs really jerking suddenly upward right now. Average egg prices have just shot up to nearly 40% higher than they were this time last year. That's not generic inflation. That's specifically because of bird flu. But all communications and instructions and data and information about trying to contend with bird flu, all of that has been shut down on Trump's orders. So when he says, oh, the last election was all about the price of eggs, I'm pretty sure this isn't what he meant. But that's what we're getting now. Meanwhile, Trump's nominee to run Health and Human Services for the U.S. government reportedly approached one of the nation's largest raw milk producers, asking him to please become an advisor to the FDA in Washington. This is a man whose company has been the subject of at least 11 different lawsuits stemming from contamination of his raw milk products. This farmer has also been the subject of 13 recalls, including for E. coli and Listeria and Campylobacter and Salmonella and, yes, bird flu in his raw milk. His products are currently barred from sale in California for making so many people sick. One salmonella outbreak his company is being sued for resulted in 171 people being sickened, including some people who got kidney failure. Now we are in the midst of the most serious outbreak of bird flu we have ever had as a country, one that is rapidly growing and affects multiple species, including now humans. It is not infecting just birds, but cats and people and cows. This is an epidemic where the CDC is advising hospitals how to deal with people coming in with flu, making sure they're tested for it, telling hospitals how they can protect patients and protect their own health workers. The CDC is warning that raw milk from an infected cow, not only just drinking it, but potentially even just being splashed in the face with it. Yikes. They're saying contact with raw milk from an infected cow is one of the ways people can be exposed to this emerging epidemic of bird flu. And while that is how the last administration was trying to get their arms around this emerging threat as recently as the end of last week, this new administration this week says, first of all, let's get the raw milk people here to Washington to advise the FDA, presumably on all the benefits of raw milk. And in the meantime, stop releasing any information on this bird flu thing, anything. Honestly, it sounds scary. Maybe if we don't talk about it, maybe it'll go away. And by the way, pay no attention to the price of eggs.